So, I mean, a really big theme this year at ASH was CAR T-cell therapy. Obviously, that's been an increasing theme at meetings over the last 2, 3, 4 years. But the really big data at ASH this year was 3 studies, so not 1, 2, but 3, all randomized, looking at CAR T-cell therapy in first relapse for diffuse large B-cell lymphoma, or indeed other aggressive non-Hodgkin lymphomas as well. So we had ZUMA-7, which was looking at axi-cell. We had Transform looking at lisa-cell, and we had BELINDA looking at tisa-cell. And essentially, the outcome was that for lisa-cell and axi-cell, so Transform and ZUMA-7, it was a positive study. In other words, the use of CAR T was associated with a significantly prolonged event-free survival. That was the primary endpoint in all of the studies. Whereas the BELINDA study looking at tisa-cell, it was a negative outcome, so there was no benefit. So this has already led to much discussion about what's the difference. Is it a difference in the product? Is it a difference in the trial design? And I think the reality is probably a bit of both, but they are different trials. That the endpoint, although it was all event-free survival, was subtly different in each of those studies. And in BELINDA, for example, you were only said to have progressive disease if you had progression at or after the 12-week assessment. So there was a sort of inbuilt delay, whereas a progressive disease event would have been called at an earlier stage, so in ZUMA-7. So there are quite a lot of subtle differences. And also the time to get CAR T cells was quite a bit longer in BELINDA than in ZUMA-7. So, and I think that's probably quite an important factor in the negative result. But the bottom line is that for 2 of the 3 studies, significantly prolonged event-free survival, and in ZUMA-7, as a trend, it's not quite there statistically, but a trend towards benefit in overall survival. There was a lot of crossover there, which does muddy the waters a bit with overall survival. So I think, my take home from ASH was that we're going to see CAR T cells come up in the treatment pathway of diffuse large B-cell lymphoma. And a study that I was very interested to see was the ZUMA-12 study, which was looking at axi-cell in the first line space in diffuse large B. So they took high-risk patients either with double hit lymphoma or with IPI 3 to 5 at baseline, and you had to have an interim positive PET scan after 2 cycles of anthracycline-containing chemotherapy and an anti-CD20. So these are really high-risk patients, and all these patients received axi-cell, and they showed a CR rate, complete remission rate of almost 80%, and a 12-month PFS of around the 75% mark, which is much, much better than historical data now, albeit they're small numbers, probably highly select patients, etc. So it's interesting exploratory data, but again, we're certainly going to see trials, I think, of CAR T-cell therapy in the frontline space in diffuse large B. So lots going on in that area.